Well, Walk with a Doc is a national movement to get people interested in taking steps towards better health. The Smith County Medical Society now has its own chapter.
Yeah, and starting tonight, you can walk with a doc. Dr. Lee E. Mitchell joins us this morning. Good morning, Dr. Mitchell. Thanks for being with us. So take us back to the beginning. Why did you guys decide it was a good idea to get in the community and get out and walk with people?
Well, you know, I think much of our inspiration came from all the efforts that the Fit City Tyler Coalition has done for our community. I've read weekly at the Tyler Fit City's efforts in terms of combating obesity, educating the public about good nutrition and that sort of thing. And as a physician, you know, we do that in our short 15-minute visits as much as we can. But I felt like in the community, we haven't had much of an impact in that sense. And so you know, I met with, I'm one of the officers of the Smith County Medical Society, and I asked our executive director, Angela Driggs, to meet with the leadership of Fit City Tyler. And we brainstormed. And, you know, during that brainstorming session, I had mentioned, well, you know, I walked with my patients about 6 or 7 years ago once a week. And then that ended up mushrooming into this coalition project with Walk with a Doc.
And it's not just walking. You're actually going to be giving some medical information at each one of these walks. What are you going to be talking about tonight?
Tonight, I'm going to be talking about wound care type topics. I'm a ETMC Wound Healing Center staff physician, and there's so many little hints that we can give you in terms of how you can avoid seeing me there. You know, I'll be going over some basic things like, you know, what do you do when you first get a cut? How do you clean it? What kind of first aid kit should you have? And what are the signs that you should maybe go see a doctor about something, get stitches, etc.
Now, will they be able to talk to you guys? I know they'll be able to talk, but will they be able to ask some medical questions when you're out on the trail doing the walk?
Absolutely. That's the whole premise behind this. This is a health literacy push. What we're going to do is have a less than 10-minute health talk on a topic that the physician chooses for that week. And then during that 1 to 2 mile walk, that physician's available to kind of educate you, answer questions, and that sort of thing.
And I know you're going to have different doctors each week talking about different topics, but you want to get people involved. So you're doing some incentives, actually, to get people on the trail with you every week.
Yeah, the national program does not require us to do this, but we have such great interest in our physician community. And so we have decided to, you know, incentivize the public who do participate in this, in that if you walk about 75% of our walks, we may enter you in a medical raffle of sorts. There's even one group considering donating a colonoscopy, another group giving some vascular testing and that sort of thing. So, you know, I don't know if people are going to be walking for a colonoscopy, but the idea is if you're going to be that proactive about your health, we want to kind of incentivize and reward.
Yeah. And on the flip side of all the information, it's good for you, right?
It is.
Yeah, I mean, I'm sure you see some patients in your practice that need to get out and take a walk and do some exercise.
They do. Exercise is so important. Dovetailing on the story earlier about happy wife, happy family, or whatever that was earlier. Well, exercise is so good for mental health, and it's so good to reduce your risk factors for cardiovascular disease and diabetes and that sort of thing. So, yes.
And
absolutely.
Something as simple as walking can do that.
Yeah.
Thanks so much for being with us this morning, Dr. Mitchell.
You.
Appreciate you. Now, if you want to walk with the doc tonight, and it's Dr. Mitchell tonight, be at the Copeland Road trailhead of the Rose Redmond Park. Check-in starts at 5:45, and the health talk starts at 6. And if you can't make it this week, no problem with that. Walk with a Doc continues for the next 7 Thursdays, same time and place, as long as it doesn't rain. So just keep that in mind.
What a cool thing.
It is a pretty good